Let me give you an example of why you can't always use absolutes in nursing frameworks, such as ABCs, and always pick the patient who's bleeding. So you have to use your clinical judgment and decide what actually matters in the moment. So let's look at a question. An emergency room nurse will give highest priority to which of the following patients? A, one who is bleeding from a chin laceration. B, one who is demonstrating a productive cough. C, one with a fever of 102. Or D, one reporting severe chest pain. Priority. This may seem like a simple question to practicing nurses, but this is the kind of thing that can trip up new nursing students because they start to really overthink all of their answer options. So a chin laceration, yes, bleeding matters, but not all bleeding is an emergency, obviously. This is a visible, controllable bleed, not life-threatening. Let's look at productive cough. That suggests infection, but there's no distress mentioned in the question. So it's important, but it's not the priority, and it's not going to be our first patient. A fever of 102. A fever alone isn't an emergency unless the question tells you that it is. So we don't assume that. Severe chest pain. Yes, of course. This is the one that can kill somebody quietly. So chest pain could be a heart attack or a clot or something catastrophic to the patient. That's why it's the priority. Exactly why you can't always say things like always pick bleeding or always use ABCs without thinking, because sometimes it doesn't apply. So remember that frameworks are tools to help you get to the right answer, not necessarily hard and fast rules.